Hey folks, Nick the Nurse here. Today we're going to be talking about some of the nursing interventions that you as an astute nursing student need to understand and be able to conceptualize in order to do well on your nursing school exams and on the NCLEX. So let's start. With valvular heart disease, one of the first nursing interventions that you want to make sure that you understand is that you want to assess the vital signs. Why? Look back to some of the signs and symptoms. Look back at, hypertension and stuff like that. So if possible, treat the underlying cause, such as a viral or a bacterial infection. Well, sure, that makes sense. If you can stop the cause, you can stop the symptoms. So we want to make sure that we're able to eliminate that root cause. So work in conjunction with the doctor to find that. Monitor heart sounds, because remember, abnormal heart sounds can be a sign or symptom of valvular heart disease. Obtain an EKG, because that can tell you a lot about what's going on in terms of the conductivity of the heart. Assist the physician in preparing the patient for cardiac cath as ordered, or if ordered. Assist the physician in preparing the patient for a heart valve replacement surgery. And I want to kind of talk about that for just a sec, because somebody was telling me, and this is news to me, because it used to be that when they did a heart valve replacement, they'd have to crack your chest open and go in and right through, and they'd have to do it that way. And perhaps that's still the case in a lot of cases, but what I heard is that they'll actually put a catheter, kind of like an IV, but a catheter up through the groin, up through one of probably the femoral artery, and go up through and into the heart, and they'll actually repair it that way without cracking somebody's chest open. To me, that's phenomenal. So as a nursing student and as a prospective nurse, you need to understand that heart valve replacement is a nursing intervention that the physician might order for their patient. So keep that in mind. You want to make sure that you assist the patient or the physician in preparing the patient for balloon valvuloplasty, which is a widening, because a lot of times the physician is going to want to do that too to establish good blood flow through those valves. Help the patient plan their activities to conserve energy and provide rest, because remember that fatigue is one of the signs and symptoms of valvular heart disease. Administer diuretics to take some of that load off of the heart. Monitor intake and output, obviously, if the patient is retaining fluid. Provide antidysrhythmic medications as ordered. Assist the physician in preparing the patient for an echocardiogram as ordered. Provide anticoagulants to prevent thrombus formation. That'll be up to the physician, but you might see things like Coumadin, you might see things like Plavix, you might see things like heparin or Lovenox. Those also all might be used. And also encourage the patient to eat a diet low in sodium. That'll help with fluid retention, and also take some of that load again off the heart. So lots of stuff here, a lot of things that can potentially be tested on nursing school exams and on the NCLEX. Make sure that you go through these. If you need to, you can watch this video again and see my smiling face. I want to thank you for watching this video today. If you'd like to check out any of my other free videos with no cost, no obligation, you don't have to buy anything, check them out. www.nickthenurse.com. Again, www.nickthenurse.com. I'd like to thank you for watching today, and I'll see you next time.